On May 15, 2026, Uganda confirmed an imported Ebola case from the Democratic Republic of Congo. Since then, 9 additional cases have been confirmed, bringing the total number of infections to 10, including the index case who later died. But why do Uganda and DRC continue to experience frequent outbreaks of infectious diseases like Ebola?
There is a belt that stretches from DRC, Central Africa, South Sudan, maybe stretching to Ethiopia, which is prone to epidemics and these outbreaks of diseases. Like Ebola originates from DRC. You know, Ebola is the name of a river in the Congo, in the DRC, where the first case of DRC was, I think, 1972, and then it was a strange disease, a strange virus. Then it was named Ebola because it hit the communities around this community. So it's an axis which is prone to some of these viral hemorrhagic diseases and strange diseases. You know, there are even theories which trace HIV and AIDS to have originated from this very region. Part of the reason the behaviors and cultures of our people that facilitate diseases which we call zoonotic diseases, sometimes interaction with the animal population in terms of hunting, slaughtering, even consuming them as food, at times is responsible for viruses crossing from these wild animals into human beings. And when they enter human beings, they undergo what we call mutation. Mutation means there are genetic changes and variations which occur, and then they express themselves through strange diseases and so forth.
Dr. Baryomunsi says effective control of such outbreaks requires a coordinated regional response with neighbouring countries working closely together to contain the spread of the disease.
So that challenges like these ones, we do not handle them alone as individual countries, but we put a regional response so that we are able to wipe out some of these diseases. Like if we succeed in containing this outbreak in Uganda, we shall not have fully succeeded until DRC also fully stamps it out, because even when we reach a point when there are now 0 cases and low risk, people can still cross and bring the infection here.
He adds that Ebola is preventable, urging the public to observe standard operating procedures and maintain high standards of hygiene. Adia Nakuti, UBC.